What's going on, everyone? Happy Wednesday. Hopefully everyone is doing well, staying safe, healthy, and having a great day so far. If you had to take a COVID test, a flu test, or a test for some other virus, I really hope you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long-term issues and no long COVID issues. It is time now for the Wednesday edition of the Virus Update for Wednesday, April 30th, 2025. If you're new to my channel, welcome to my channel. This is where I do the daily virus update on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there, and you need to know what's going on with each and every one of these viruses. I give you the latest news, data, information, not just United States, all around the world, COVID studies. We talk about long COVID. We're going to talk about long COVID today. It's something I'm dealing with, and basically anything you need to know to help keep you safe and informed. Want to stay informed? Subscribe down below, give this video a thumbs up, hit that notification bell, share this video with anyone you know, and of course, leave your comments down below. We do have a few news stories to talk about today. Then I do want to go over the symptoms of long COVID. You may have seen on X, you may have heard me mention yesterday, you may have seen on Blue Sky or somewhere else. I did have a doctor's appointment today, so I do want to talk about that. It's long COVID related. And I went to my sleep-pulmonary doctor, which I'm seeing him for both reasons. We'll get to that after we get through a few news stories. First off, 2 more measles cases have been reported in Montana. This is in Gallatin County. The health department announced Tuesday 2 more people connected to previously reported cases of measles in the county have tested positive, and both individuals were not vaccinated against the measles. And it sounds like the total number of cases now, let's see, 2 additional cases come nearly 2 weeks after the health department reported 5 cases. So this is now a total of 7 cases. And yes, this is Montana's. It says it right here. 7 cases. Montana's first cases of measles since 1990. Remember we mentioned this, maybe it was a week or 2 ago? Yeah, this is not a good thing. You got the virus under control for that long, and then suddenly now they're up to 7 cases. Again, first time they've had any cases since 1990. All right, I got to show this to you. Measles cases jumped, this is in Kansas now, to 46 in 8 southwest counties as new Kansas law restricts health officials. Yeah, this is kind of a, not a good thing. So let's go down here. Topeka, new legislation may make it more difficult for public health officials to manage a measles outbreak, which has increased by 9 cases. Measles cases in Kansas jumped from 37 to 46 over the past week, with all cases located in southwest counties, according to Kansas Department of Health and Environment data released Wednesday morning. Yeah, this is not good whatsoever. Let's go down a little bit. The bill says those who are quarantined can file a civil lawsuit that must be heard within 72 hours if they believe the decision was unjust, the governor says. And yeah, so the ability, let's actually back up for a little bit. I skipped over something here. It's part of long COVID. I get mixed up sometimes. Let's go back here. The legislators' passage of Senate Bill 29 may complicate the ability of local health officials to react to the increasing number of measles cases. This bill removes the ability of local health officials to ban public gatherings during infectious disease outbreaks and added the exception that health officials show probable cause if they quarantine or isolate individuals during an outbreak. Why do this at all? Come on, these measures. I mean, so say there's an outbreak. Oh, well, you have an outbreak going on, but I'm sorry, you can't ban gatherings. Okay, so they're okay with people gathering together. That could potentially be infectious. Just totally ridiculous and uncalled for. Let's just move on. Speaking of large gatherings, there was a large one for the Pope's funeral, and, well, there's some illness, new. Pope, 2 Catholic cardinals to miss the conclave due to illness. I'm not seeing what their illnesses are. Is it something that happened there, or are they just having ongoing health issues? And some are saying, oh, well, all these people were gathered together, and, this is going to cause a COVID outbreak. We don't know if COVID actually spread there. We don't know if flu or anything spread there, but 2 of the cardinals are dealing with illness, and it looks like because of that, It's only going to be 133 total. All right, moving over to whooping cough. Whooping cough cases on the rise in Pennsylvania. Yeah, no surprise here. It's rising everywhere. In fact, there have been about 8,500 cases across the country and in Pennsylvania. Data shows Pennsylvania is leading the case count with 207 cases. So we're one of the higher states at this point. I don't know that we are actually the highest state, but yeah, not a good thing. All right, Dennis, the COVID info guy. Air filters in classrooms reduce sick days by more than 10%. Putting air filters in classrooms seems to boost student attendance, which may be due to them reducing levels of air pollution, pollen, pathogens, or all three. How about that? Yeah, we've known this for some time. I got an air purifier here. I got one downstairs. Of course, it's turned off at the moment. Sometimes it's a little noisy while I'm recording, so I have it off. But as soon as I'm done, it's going right back on. See, look at that. It is so easy to put an air purifier in a classroom. It may actually prevent illness. It may also prevent the teachers from being sick as well. Yes, it can actually happen. All right, back here in the United States, health officials confirmed tuberculosis case at Dillard High School. Yeah, TB, we've talked about it a few times. The Florida Department of Health in Broward County said an individual with active tuberculosis was recently on campus. Officials didn't specify whether the person was a student, staff, or faculty member. So, yikes, that's not good. And I did tweet this out. You can read more about this, but we will read one thing here. What are the symptoms of TB? Prolonged cough, chest pain, weakness or fatigue, weight loss, fever, and night sweats. So, yeah, there's a lot of different information here. Again, I did tweet this out, posted it over on Blue Sky. You know what? Maybe I will also post this on my new Facebook page, Data Report, as well. I got to start posting some more news stories to there as well. All right, let's take a look at Italy. Italy for COVID. 1,200 cases in the last 30 days. 17 cases among healthcare workers in the last 30 days. 70 years is the median age. And cases by sex. Male, 49.3%. Females, 50.7%. 33 deaths in the last 30 days. 585 recovered in the last 30 days. Taking a look at what's going on in Queensland, in Australia. This is Dennis, the COVID info guy again. I'm telling you, if you don't follow him, make sure you do. Here's the respiratory report from April 23rd to April 29th. Reported cases, 303. Influenza, 816. RSV, 608. All these numbers dropped by a decent amount, so that is some good news. COVID hospitalizations are down by 20%. 51 reported. Influenza, 80 cases. RSV, 58 cases. That is unchanged at this time. Alrighty. We need to talk about long COVID. So, today I had a appointment with my pulmonary and sleep doctor. I've been seeing him for what? I want to say about 2 years now. And this time I was seeing him for sleep-related reasons, tiredness, fatigue that I've been dealing with since my winter infection. If you don't know, I'll give you a brief summary here. Back in the winter, I got infected with COVID again. My first case was back in 2020. It was a suspected case. There was no testing. I was one of the very first people to have COVID. Well, I got COVID again around the holidays, and I think I've traced my case back to the grocery store. I mean, I was masking at the time, but you know what? When there are just so many people, it was Christmas Eve, I went to the grocery store. Yeah, I know, I truly regret it. When there are that many people in the grocery store, and there's not enough people masking, one-way masking is just not going to work. So I told him the story that I got COVID, and then it rebounded, or the virus was not done with me. I tested positive again, and that lasted several weeks. And I said, I've been getting these headaches, and I've been dealing with fatigue where I'm just tired in the middle of the day. And he asked if I'm feeling better, and I was honest with him. Several weeks later, up until about just a couple weeks ago, I mean, there was a little bit of a period where I finally did start feeling better, but now these last few weeks, we'll say week and a half, 2 weeks again, yeah, I'm just not feeling myself again. The headaches are back, and the tiredness. I'm tired right now. I mean, but we're getting through with this video. I'm getting mixed up sometime. And some of you know I did have an MRI done by my primary doctor, he wanted that done. He also wanted me to do an MRA, which, when the headaches started getting better, I said, you know what, maybe I'm not going to do this, but I'm back to the point where, yeah, I'm probably going to go through with the MRA. I'm going to be calling one of these days and see if I can't get it done next week. And anywho, long story short, I got results of my at-home sleep study test today, and it was just only minor for sleep apnea. It was basically, we'll just say, negative. And what he wants me to do is he wants me to take things a step further. Because of the fatigue, I told him I sometimes get tired while I'm driving. You know, that's concerning. That can be scary. So he wants me to do an in-facility lab test at a hospital. It might be Lankenau Hospital, which is out on the main line section of Southeast PA. There were 2 different hospitals. Could also go out to Plymouth Meeting, Pennsylvania. I live in Southeast Pennsylvania. We'll have to see. I'm not certain if I'm actually going to go through with that, and I'll tell you why. I have to see how much it's going to be covered by insurance. It may not be. It may be where there's a huge out-of-pocket cost. So we'll have to see what goes with that. And I asked him, I said, you know, I've been doing some research about chronic fatigue and long COVID, and he even said long COVID can go on to develop a whole bunch of different things. You and I know that. We talk about it here on the channel many, many times, and I mentioned chronic fatigue, and he said, yeah, that's definitely a possibility, what I could be dealing with. He said, maybe to help better understand that, he said that the sleep study in, you know, where I stay overnight at a facility, may help figure that out. Don't know, but we'll see. One step at a time. I gotta see what insurance says and see how much insurance. If it ends up being thousands and thousands, well, then obviously I'm not gonna be able to do it. I've got to figure something else out. But we'll just see here. But one thing I am going to do now is this MRA, and I even said that to him today. I'm probably gonna have an MRA done. My primary doctor wants me to have it done. The headaches, they're back again. I mean, you remember I was telling you all that, hey, they were starting to feel better, but they've been getting worse again. I don't know if it has anything to do with allergies. I mean, my allergies have not been bad. Allergy medicine is working. So I want you to understand that, hey, if you have COVID, you could go on to have problems, and your problems could be COVID. Maybe you clicked onto this video today, and you're dealing with some new health issues. Let me tell you something. There's over 200 different symptoms of long COVID. Since the last time I've talked about this, we've gained a few new subscribers, followers. Maybe you're someone new. Hey, welcome to my channel. Let's just talk about some of these symptoms. The majority of people, they go on to get COVID, and they recover. But at random, there are people who do not recover from COVID. I'm one of them, and there's millions of people all around the world that can raise their hand to that. Some of them are followers right here on my channel. I talk to some people over on X and different places that are dealing with long COVID. I mean, I get it in the comment sections. Yeah, it is a real issue. And yes, fatigue, tiredness or fatigue that interferes with daily life. So, say you get a full night's sleep. You sleep a full 8 hours, right? And then you wake up and you're still tired. Hey, that was me this morning. I woke up this morning and I came here to my computer to help get ready for this video. I was like, wow, it was like 6:30 in the morning. I was like, gosh, I am just still so tired. I went back to sleep. Woke up again at 8:30. Was still tired. Doesn't matter how much sleep I get. And sometimes it comes with these headaches. So that could be a piece to the puzzle as well. It's definitely something caused by long COVID. I had yet even more confirmation today. This doctor said, yeah, COVID. I mean, I've had multiple doctors now say long COVID. So it's definitely there. But the tiredness, that's my biggest issue. Tiredness and headaches. Symptoms that get worse after physical or mental. Effort, fever, difficulty breathing or shortness of breath. That was an issue I had post-COVID round 1, my first case. And now I also go to this doctor for that. And I do get a injection every month. And that does help me. But I still do have some problems once in a while when it comes to summertime. You know, the heat. I notice my tolerance to dealing with heat has gotten much worse. I mean, before, okay, a hot day, yeah, fine. If 90-degree day, of course, that's going to impact everybody. Me, and even if it just gets near 80, you're like, okay, that's too hot. My tolerance. But some good news today. I got to say this real quickly. He checked my lungs. He said my lungs felt great. So that's fantastic news. Because many of you know I possibly had pneumonia with my COVID case back in the wintertime. Difficulty thinking or concentrating, sometimes referred to as brain fog. Can raise my hand to that once in a while. I do get mixed up. I do forget. Sometimes I've even asked people, what day is it? And I'll repeat myself and say that multiple times in a single day. Yeah, not good. Actually drives my dad really nuts. I told you what day it is. I said, sorry, I forget. Headaches, sleep problems, dizziness, pins and needles feeling, change in taste, diarrhea, stomach pains, on and on we could go. There's a lot of different symptoms of long. So let's move on, as we do have several more things to look at. Canada, the viral activity level for COVID-19 is moderate. Flu A is moderate. Flu B is moderate. RSV is low at this time. Nothing more on measles. I don't know. Is there anything to look at on the website? I haven't looked this afternoon. I'll be looking over the website this evening. It's not refreshing. I'm pretty sure there's nothing. Let's take a look at what is going on with bird migration. We'll look at the UK tomorrow. Probably going to be a similar time for tomorrow's update as well. Got some things going on tomorrow. Taking a look here, we can see live bird migration map. And take a look at this. Let's see if we get up into the 400 millions again. Oh, yes. Well over 300 million. Over 400 million. Yeah, look at that. Over 400 million birds in migration, which, as you know, could potentially spread bird flu. Alrighty, before we continue on, let's stop and take that hydration break. I need to take it right now and catch my breath for a moment. Alrighty, taking a look here. We do see here in the southeast there is some air quality concerns. That's going to continue over the next several days, and then maybe Saturday, Sunday, and much of next week there could be some sort of a storm system in the southeast. I've been watching this on the weather models, and it could be a prolonged one. It could be actually beneficial for drought-stricken areas, but maybe too much rain at once. I don't know. We need to figure that out. On the west coast, we can see here that there is some bad air qualities in Southern California. That's definitely a problem. Central California as well. Great Lakes, just a few minor areas. And again, I mentioned in the east, could be a storm system. Follow me on my climate data report on Blue Sky and over on X. Maybe I will chat about that there this evening or at some point. All right, taking a look at what's going on in Pinellas County, Florida. Just a few calls going on there. Actually, several, but not as many as the other day. And still, take a look at this. Some hospitals with ambulances sitting there waiting to discharge their patient. Philadelphia, yet again, over 800 EMS calls. More days than not. We're starting to see that happen now. And I really should make a spreadsheet where I start tallying up the calls. I think I'm going to do that, actually. Just make a spreadsheet where I just punch in each a day. And we can actually see what the trend is. We can just go down through the chart. Maybe I'll do that. We'll see. Taking a look at what's going on in Montgomery County, Pennsylvania right now, we can see there are a total of 14 EMS calls at this time. Cardiac arrest in Upper Dublin. Went through that township earlier today en route to the doctor's office. Yikes, cardiac arrest. Not a good thing. Whoa, Chester County, Pennsylvania. Look at all these calls. Wow. Respiratory difficulty showing up a few times. Sick person. A lot of fall calls. Hemorrhaging, injured person. Heart problem a few times. Unresponsive person. Yeah, a lot of calls going on there. I hope the hospitals aren't busy today. Sorry, I'm just looking at this. You can see here, yeah, there's a few in central Pennsylvania that are dealing with problems. We still have that one here. What's going on down here? Emergency department overcrowding at Riddle Hospital. Yeah, that hospital at this time, it has not updated. And then I did mention one hospital, Lankenau. Yeah, that's the one that I may have to have a sleep study done. Nothing going on there. Then there's also another one out in Plymouth, Maine. I believe that would be Einstein. Lehigh Valley, not terrible today. The hospital, Monroe, and Pocono. Emergency department overcrowding, and what's going on at Geisinger St. Luke's Hospital. Emergency department overcrowding there as well. Taking a look at New Jersey. Hopefully all is well there. Penn Medicine Princeton Medical Center. Patient volume. So full and total divert possibility there. We're also seeing Innsbruck, Mannington specialty issue. It looks like a surgical divert. Taking a look at New York State. 479 people have tested positive there. And taking a look at the New York State hospitalizations, they did drop today to 687. All right, let's take a look at a few wastewater sites, shall we? We'll just randomly go along here, and then we'll call it a day for this video. Memphis, Tennessee. Not calculated, but we can see here the COVID level. Your COVID level is going up slightly. RSV is low at this time. Influenza A is low. Influenza B is low, but it did go up a little bit. HMPV is low. EVD 68 not calculated. None of these are calculated. And we do see there are some detections of hepatitis A and norovirus. Looks like it would be either in the low to medium category. It did go up a little bit in the month of April. Let's go out somewhere further to the northwest. How about we go out to Las Vegas, shall we? And we've been keeping our eyes on Las Vegas. Median for COVID rising slightly. RSV is low. Influenza A is low. Influenza B still listed at high, but dropping. And I got to correct myself. Influenza A is actually listed at medium at this time. HMPV is low. EVD68 is low. Norovirus is medium. Hepatitis A, some detections of that at this time. Alrighty, folks, that does it for today's edition of the Virus Update. We will have another Virus Update again tomorrow afternoon. Follow me on X, Blue Sky, Facebook. Also, Climate Data Report as well. I think I am going to be doing some postings there about that potential heavy rainfall event in the east. And yeah, follow me over on Data Report. Ways to support the channel are down below. Anything else? Alrighty, folks, that does it for today. If you enjoyed this video, give it a thumbs up, subscribe down below, hit that notification bell, share this video with anyone you know, leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Wednesday evening. Thanks for watching.